Flying at cloud base, high above stunning wilderness scenery, is something that most paraglider pilots love to do, but it's important to be prepared for every eventuality.
My name is Matt Wilkes. I'm a remote medicine doctor and paraglider pilot.
And my name's Jocky Sanderson. I'm a paragliding guide and mountain rescue personnel.
Jocky and I have spent many hours trying to work out how we can make paragliding accident management safer and more efficient. Paragliding accidents don't take place in a normal first aid setting. They take place in remote areas where fellow pilots are first on scene, and what they may need to deal with may be more severe than what's taught in a normal first aid course, and also what a normal first aid kit would be capable of dealing with. As a result, we've devised our own first aid kit, and we've thought enormously hard about how to make this the perfect blend of lightness, compactness, and clinical performance. We've chosen this equipment based on our experience of working in trauma centres in the UK, of mountain rescue in the hills of the lakes, and in attending incidents around the world.
So it's made out of ripstop nylon, and it comes like this packed up, but you can undo it and unroll it. Packs nicely, slides into a harness. So I'm going to show you what's in it, and Matt is going to show you how to use it. So you arrive on scene, and the first thing is you a bit of a kerfuffle, and you just, what do we do? So what we've done is we've got aid memoirs in all of the pockets in the time you should use them. So straight away we've got Dr. CABC, which is all about assessing the danger, the response of the casualty, checking for catastrophic bleeding, and then airway, breathing and circulation. So in the first pocket we have our state-of-the-art, top-of-the-range dressing, which Matt will explain all about. And in pocket number 2 we've got the hemostatic dressing, which again Matt will explain how to use it. So that's for the catastrophic bleeding. So we've also got the gloves straight away to prompt you to put them on to protect yourself, and then we've got the sharps in the second pocket, okay, which you can use in advanced trauma care or just to cut the harness off. And you've got a syringe in there to wash out wounds and needles. And then as we go through to control bleeding and small cuts, we've got the sutures, and for splinting and immobilizing and also to protect the pelvis, we've got the foil splint, okay? And there's even instructions how to use that in there. And finally, you've got the CAS card, which helps you to not forget anything, and you fill it in using your lovely pen that's in its pouch. And this pen can be used to write on this plastic paper or onto the micropore tape, whichever. But it's a great way of making sure you don't forget anything. And also when you hand over to the paramedics when they come, then you just basically give that, and that gives a really good timeline of the casualty, their breathing rate, their pulse, and their state of alertness, etc., which is really good for a paramedic to give a handover so that he can treat them efficiently. You can replenish the stocks or buy the kits by visiting escapeXC.com, and you can just call us.
At the heart of trauma care lies the ATLS algorithm. As you will know, that begins CABCD, starting with the control of catastrophic hemorrhage. So let's first focus on the items that we have in the kit for hemorrhage control. The key way to manage bleeding is to apply pressure to a wound. That pressure needs to be of adequate force and it needs to be sustained. As our performance option, we offer the APLS modular bandage. We believe that this is the most effective trauma dressing that is currently on the market. Now, one of the things that you'll notice as we go through this bandage is that it's got Velcro loops all through it. And the aim of this is that it's going to help you secure it and maintain that tightness as you go round. The first thing that you see when you unroll it is a suction cup. That goes on the outside of the wound. On the opposite side is a pad. So the pad is applied to the wound and the dressing around it. And what you can see is that as we go round, each of these strips helps you hold the tension of the dressing in place. Really use the elasticity of the dressing when you put it on. Pull it out and wrap it over. And again, for extra security, there are clips on both sides. All of these features can be used to apply really, really effective direct pressure. The suction cup can be used to apply pressure directly over the point of wounding. It also serves as an excellent indicator to future rescuers where the wound is. They don't have to guess where under the pad the issue is. You can also use it to pack wounds. Contained within the main pad of the dressing is 5 meters of gauze that can be pushed into a wound to pack it. Also contained is this occlusive layer. Now, traditionally this would have been used to improvise a chest seal for those with more advanced rescue skills. Though these have largely been superseded by bespoke devices, it's still a useful option in a remote area. When packing a wound, we offer you 2 options. The first, standard sterile non-woven swabs, 5 of these that can be packed into a wound, but we have them in the standard kits anyway because they can also be used for dressing more minor injuries. Our performance option is the Hemcon Kaito gauze. So like normal gauze swabs, except this time it's been impregnated with an agent that allows blood to clot much, much more effectively. You pull out the gauze and you push it into the wound, particularly if the wound is in a body cavity, to find the bleeding point and to push all of this sequentially as tightly packed into the wound as possible, and then apply pressure either with the trauma bandages or with your hands for 2 to 3 minutes while the agent works. The reason why we've chosen this particular hemostatic agent is because it comes as a bandage. Originally these came as granules which could go all over the place. This really allows you to pack into the bleeding point. It's also very lightweight. It has a long shelf life of 5 years, which is important given the cost of the kit. And it's got this blue radio opaque line. So this means that when your friend is in hospital being x-rayed or CT scanned, this will show up. So again, it's a means of handing over non-verbally what's gone on the hill. So one of the things that you come to is needle and syringe. While this can be used to give injections, what most people will use this for is to wash wounds. So when you're washing a wound in the outdoors, if the water is good enough to drink, it's good enough to clean. And the key thing is volume and pressure. So you draw with a 10 ml syringe, and then by putting a green needle on the end, that allows you to give a jet of water just where you need it to be to clean the wounds. The next thing we come to in the kit is the thumb scalpel. This has a bladed edge and a pointed edge. You'll find many uses for this. That it might be cutting glider straps to help get a casualty out. It might be trimming wounds. It might be cutting bits of tape. For more advanced care, we've included a thumb scalpel so you could do things like thoracostomies or emergency surgical airways. The next thing we come to for dealing with minor wounds are steri strips. These are extremely useful for closing wounds in a clean and effective way. We've deliberately chosen ones that are thicker and a bit longer for ease of application, and so we can do it cleanly in the field. No first aid kit would be complete without an old school triangular bandage. One of the things that we talk about in our first aid courses is the importance of splinting, both for hemorrhage control and for pain management. Triangular bandages are incredibly useful for improvising limb splints and also when binding the pelvis for tying the ankles together. But nothing is to stop you making an old school St John's Ambulance sling. The tape that we've chosen has a high tensile strength, so it can be used to strap ankles that have been twisted. It's white, so you can write on it if you need to mark a casualty. It can be used to dress blisters, and it should perform well in the wet. When we made this kit, we deliberately left space in it so you could include your own items suitable to whatever you were doing in the remote setting. We would suggest that every person includes in this paracetamol and ibuprofen. The dose of paracetamol for an adult over 50 kilos with no health problems is 1 gram or 2 tablets. The dose of ibuprofen is 400 milligrams. You should be cautious with ibuprofen in those who have not taken it before, and in particular asthmatics, the elderly, those with kidney or those with stomach problems. The lightweight foam and aluminium splint. We think that this is an ideal way to splint casualties, or as part of a splinting system for casualties in a remote incident. Not only are they very lightweight, But when you unwrap them, you can then put them in different configurations to fit your equipment well. For us paragliders, we put them in the back of our harness or under the seat. On the front of the roll are some instructions, so if you can't remember what's in the video or you need a little prompt, that will give you some hints about how to immobilise common injuries and use the splints. One of the key principles of trauma care is that the first clot is the best clot. So what you want to do is minimise the movement that a casualty experiences, not just for pain relief, but also for hemorrhage control. Once you've unrolled it, fold it over lengthways, and that gives it strength. Then, depending on the part of the anatomy that you're trying to splint, form it on somebody who's uninjured. So for example, if it was a wrist, I would do it on me. I'd form it into the shape that I wanted it to be. And then it's just ready for when you apply it to the casualty. And this is a wonderful use for your triangular bandage once you've got this to suspend this in a sling. If you're immobilising an ankle, then this is really where having a friend's splint or another straight item can really help. What you want to do with an ankle is immobilise it in all the directions in which it can fold. So start with that if you've got one. If you have another, then do it along the back as well. If you need to use this to splint a long bone fracture, then open it out to length and then fold the splint in half and half again, forming a gutter the whole length of the splint. Then integrate that with whatever you have around you, be it walking poles, glider straps, as part of a system to really give the most secure, pain-free splinting option that you can for your friends. One of the key interventions that we talk about on our first aid courses is binding the pelvis. This is a way of bringing pelvic fractures back together to reduce bleeding and to reduce the area in which blood can pool. This is a very simple and potentially life-saving intervention in a heavy crash. When we are binding the pelvis, we're aiming for the level of the greater trochanters, those are the knobbly bits on the side of your leg, and by wrapping the splint around and then taking a jacket or the triangular bandage to tie it off and apply pressure, this can help even out your splint as it goes around the body. Having gone through the kit, we now like to talk about some of the things that you can do wrong with it. You should use this in proportion to your skills, knowledge and training. These trauma dressings can go on very tightly, so when you put them on, while your primary aim is to stop bleeding, it's always worth checking that there's a pulse further down, that you've not effectively made a tourniquet out of it. It might be that that's what you need to do, but have that in the back of your mind. The hemostatic agent contained in this gauze is made from a product derived from shellfish. While that product has been stripped of the chemicals that could cause an allergic reaction and none has ever been reported, that's obviously something to have in the back of your mind. Finally, there are sharp things in here. It's never good practice to resheath a scalpel or to resheath a needle. That's often when people get needle stick injuries, and make sure that you dispose of these safely in a sharps bin. If you don't know where to dispose of them and you've been involved in a rescue, taking them to your local hospital or GP surgery would be a good option. While there are many things that you can do right with this kit and many things that you can do wrong, the most important thing is that you use your judgment, that you try your best, that you make doing no harm your primary goal. But fundamentally, think about it this way. If it was you who was injured, what would you want done to you? And if the answer is X, Y, and Z, then do that and do it to the best of your ability. Good luck and let us know how you get on. If you would like some further training, please visit the Escape website where we have listings of our courses where we show you how to look after your friends in remote trauma.